Let's review what to expect before, during, and after your surgery. Remember, you select me because my commitment, experience, and training will help ensure your safety. And that starts with the preoperative workup. We carefully examine your pupil under dark conditions with infrared technology to determine the pupil size in darkness. We carefully check for the dry eye. We check the thickness of your cornea, and we perform advanced mapping techniques to determine the configuration of your cornea, again, to ensure safety. Now, some of your workup may be done by your optometrist and the rest by us, or we may do all of your workup. Now, depending upon what we find at the workup, we may elect to use either the Vizx S4 laser or the LADAR laser. Both lasers are equipped with the latest tracking technology, iris registration, wavefront capabilities, as well as large pupil configuration ablation zones. Now, in some cases, depending upon what we find, either your cornea is too thin or your maps are unusual or you're just too nearsighted for LASIK or too farsighted for LASIK, we may elect to do one of the advanced surface procedures, which we're going to discuss later, or we may decide to put in what's called a phakic intraocular lens, or remove the lens inside your eye, called a clear lens extraction or refractive lens exchange. Or in some cases, you may just not be a candidate for any type of refractive surgery at all. I must turn away 4 or 5 patients a week just because it's not safe to do their procedure. Now let's discuss what to expect on the day of surgery. First of all, it's cold at the laser center, so make sure you wear a sweatshirt or a sweater. Also, you have to bring a driver. You can't drive back from the laser center after your procedure. Now, if you're going to have conventional laser, then plan to be at the center about 2 hours. If you're going to have wavefront guided surgery, then plan to be there about 3 hours. When you get to the center, we'll have you do some paperwork, and then we'll give you a Valium. Then we'll instill multiple drops of antibiotics and powerful numbing drops, and we'll cleanse around the eye with iodine solution to sterilize the area around the eye. Now, I'm the only surgeon performing these procedures, and I will talk you through the entire surgery to make you feel comfortable. Here's a little vibration and some water to stay super duper still. Perfect. Excellent. Good. Good. And then just look right in the center. Perfect. The surgery itself only takes about 15 minutes, and believe it or not, there is actually no pain. Because the numbing drops are so powerful, you'll feel some pressure, particularly in the second eye. Everyone, probably because of anticipation, feels a little more pressure in the second eye. There's actually not more pressure in the second eye. It just feels like there's more pressure. But the pressure in either eye isn't too bad. The procedure takes 5 to 7 minutes per eye. And after the procedure, you'll wait in a waiting area, and then we'll examine the cornea to make sure the flap is just right, and we'll give you postoperative instructions, both orally and written, and then you go home. Now, after your surgery, I want you to go home, rest, and relax. I want you to just keep both eyes closed and take it easy. No watching TV, no working on the computer, no doing emails, no doing paperwork, no phone calls. Just rest and relax and keep your eyes closed. You can listen to TV or listen to your iPod or get some books on tape, but the most important thing is you let those flaps settle by keeping both eyes closed. It's really funny, actually. A number of patients have had friends that have had surgery at other centers, and they say to me, "Hey, doc, how come my friends could go out to lunch or go out to dinner after laser surgery, and you're making me go home and keep my eyes closed?" Well, that's why you choose me. Safety first. As I tell my son, just because your friends do something wrong doesn't mean you have to. So what should you expect on the first day after your surgery? Well, your vision is going to be vastly better than it was before surgery without your glasses, but it's not going to be perfect. Some people describe their vision on the first day as looking through a lens with a little Vaseline smeared on it or looking through a fine veil of gauze. Your vision's much better, but the edges are not necessarily distinct or crisp. And this is because there's some dry spots on the surface of the cornea or some swelling of the flap, and that takes a few days to a few weeks to crispen up, but it generally does. Now, most people can drive to their first postoperative day appointment and drive to work. You can plan to go to work the next day. But rarely, very rarely, patients can't see well enough to drive on their first postoperative day, so you should have a driver lined up as a backup. Now, at that first postoperative visit, we'll examine your vision, and we'll look carefully at the eye, looking at the flap to make sure the flap is well positioned, that there's no evidence of infection or inflammation, that there's not too many dry spots, and we'll go over your postoperative drop regimen. Now, in some cases, you may actually need to be prescribed temporary postoperative glasses, and that's if you're slightly overcorrected or slightly undercorrected, or there's the induction of some astigmatism where no astigmatism existed before. Now, in that case, we may elect to prescribe it on the first postoperative day, or we may want to wait a few days, maybe the 3rd to 5th day postoperatively, to get the best possible pair of glasses. Now, you'll need to wear those glasses about 3 or 4 months as the eye heals, and then once the vision is stable, then we can go ahead and perform an enhancement procedure.